Hi, I'm Dr. Ian Ryans. I'm a GP and also clinical lead for MSK in elective care reform in the GP federations in Belfast and the southeast area. I just wanted to introduce some of the work that's being done by the Healthy Living Centres across Northern Ireland in their pain support programmes. Like other parts of the UK, in Northern Ireland we have concerns about the high prescribing of pain medications and also the drug-related side effects and indeed deaths that can be associated with that. We know that pain medications have very limited effects in chronic pain, and in most cases, medication will reduce pain by at most around 30%. However, GPs and prescribers are often frustrated by the lack of accessible alternatives to prescribing. This message also still does not seem to be well known among the many who are suffering with chronic pain. With the Healthy Living Centre pain support programmes, we have been developing a resource for patients to find a way to help the 1 in 5 of our population with chronic pain to learn to manage their pain and so improve their quality of life, reduce their reliance on medication. Patients can directly refer themselves to the pain support programmes in our Healthy Living Centres, and you can also signpost patients to the programmes. Details of Healthy Living Centres across Northern Ireland can be found on the Healthy Living Centre Alliance website, www.hlcalliance.org. Please make contact with your local centre to find out more about the programmes running in your area. Tony Doherty, coordinator of the Northern Ireland Healthy Living Centre Alliance, is going to tell you a bit more about the programmes.
Hello, my name is Tony Doherty. I'm the Regional Coordinator with the Healthy Living Centre Alliance, and we have 29 Healthy Living Centres in our membership scattered well across the region. A number of years ago we started thinking about pain support and got chatting to the Public Health Agency and the Health and Social Care Board about the possibility of doing more for those who live with long-term persistent pain. And since then, since 2018, we have trained over 40 staff who are all now well up to speed with pain in terms of its manifestations and so on. And we have implemented quite a number of pain support programs in Healthy Living Centres targeted at those who are least likely to take up the opportunity. And the program is basically around getting people to understand their pain better, to accept their pain better, and to live better with it, and also to find out more about issues like sleeping, which is a huge problem with pain, diet, linking them up with pharmacy for discussion, engaging people more on social inclusion and get them to meet people who are in a similar position to themselves. The programs have been really successful. As a matter of fact, they've been so successful that last year we won the Press Kip Award for delivering across integrated settings in terms of medicines and pharmacy development. And so we're going places with this program, and we would like to link up more with yourselves as GPs in terms of your patients getting a better deal or a better service in terms of how their pain affects them. We know it's a huge problem for yourselves as well, and it's not always easy to treat. And often patients are treated with medication, which is quite often the only thing you can do. So we think we're onto something really good here, and we would like to work with GPs across the piece on it. So if you would like to find out more about the programmes and the possibility of maybe your patients taking part and how you might refer, give me a call on 07921 810 642 or send me an email on tony@hlcalliance.org. Thank you very much.
Kathy suffers from a number of conditions such as fibromyalgia and arthritis, and was medically retired after 40 years in the same job due to her failing health. She started attending the pain support programme at the Top of the Rock Healthy Living Centre shortly after retiring.
I was stagnating in the house and I thought, this is my life. Is this what my life's going to be like from now on? I done nothing. I sat in the house and put on weight. If I hadn't have come to this group and met the people that I met and took the opportunities that I've taken, I would still be sitting in the corner of this tea in the living room watching rubbish daytime TV and feeling sorry for myself. You have to have something to focus on, something to make you get up, do things, push yourself. But not to the extent where you're lying down the next day, but you'd be sore the next day, and I do be sore. But I'll always be glad that I've done it. My husband says I be buzzing, and he hadn't seen me buzzing in a long time. So he loved it. He's loving it too, like, you know, because he worries about me. He would worry about me sitting in the house on my own, doing nothing, having too much time on my hands to overthink things, you know, so yeah. But I don't take the actual traditional type pain medication as often as I used to. I think that's probably because I'm a wee bit more mobile. I have recommended it to my aunt and one of my best friends who both suffer from chronic pain. This is going to sound really corny, but I've gained a different outlook. My pain doesn't control me anymore. I have decided that I am capable of doing other things if I want to. I have to want to, obviously. But the main thing I have gained is friendship. I have met loads of people through this course.